Okay, so talking about good housekeeping practices. So defined with what is housekeeping and what is good housekeeping. Housekeeping, I think everybody is aware of this terminology, which is nothing but the provision of a clean, comfortable, and safe environment for the patient and public in a hospital setup. So, आपके patient, the walking public, your hospital, your healthcare worker, everybody should have a clean and a comfortable environment wherein a person can move in. So that is all maintained by a housekeeping. The concept of housekeeping, as we know, it is day-to-day activity at our homes also, at the working place also. It is very simple, but to make it complex, if it is not done properly, it becomes a complex procedure. When one considers maintaining a house of several hundreds of rooms and numerous public areas, the task becomes gigantic. एक या दो चीजों की बात होती है, तीन कमरों की बात होती, it can be maintained well. When you're dealing with numbers, when you're dealing with a very large surface area, the teamwork, the efforts have to be even more considerable and even more wide. So what is the role of housekeeping services? The housekeeping service is responsible for the regular and the routine cleaning of all the services, maintaining a high level of hygiene in the facility, in the hospital setup. Then there is classification of different areas, demarcation of different areas, which are the hotspots, which are the critical areas, which are the semi-critical areas, which are the non-critical areas lined up in your hospital. So classifying the different areas of the according to the varying need of cleaning. Which, like your hotspots, require much more attention. Your ICUs, your OTs, they require a different set of housekeeping practices and protocols, infection prevention protocols, which has to be followed up. Whereas wards, how should be and how frequently they should be monitored and surveillance should be done. What is the role of housekeeping services? So at most, when you're starting with any procedural activity, you need to have a policy. जब तक आपके पास कोई policy नहीं होगा, जब तक आपके पास एक written document नहीं होगा कि what exactly the protocol or the flow chart has to be followed up, what techniques you are going to follow up in your good housekeeping practices, that has to be jotted down. A standard operating procedure has to be maintained. So developing a policies which should be monitored and amended as and when required. Then developing policies for collection, transport, and disposal of different types of waste. Nowadays, it is very, very important because CPCB, Central Pollution Control Board, has defined it very nicely. In 2016, the amendments were changed, then the further demarcation in 18 and 19 were done. So how the biomedical waste is collected, first of all, how it is segregated, how it is collected, how the transportation of the BMW biomedical waste is done, and at the end point, how well it is disposed. It should be all monitored as a part of housekeeping services. Then pest control, when flies or mosquitoes, now that we have summers lined up, after that the rainy season will come, pest control activities, how to control of the flies, that should be taken into account, and how frequently you are doing this pest control is very, very important. Then the next one is establishing methods for cleaning and disinfection of bedding. Same way, pest control के बारे में अगर आप बात कर रहे हैं, so is there any ticks or mites lined up? Any dust is there? Any bacteria? With COVID, I think we all have learned that clean surfaces, clean hands, hygienic practices has to be clean. Inhalation, your barriers should be there if at all any COVID patient is there. So mattresses and pillows, how it should be maintained, how it should be clean, and how well it can be disinfected if at all it is soiled, should be taken care of. So if I can say it again for housekeeping practices. Second. Okay. As I just said that, what are the roles? Do I have to explain it again? For regular and routine cleaning practices, high level of hygiene should be maintained and different hotspot areas should be demarcated well in the hospital setup. And that is how a good housekeeping practices can be maintained. What are the rules? As I said, developing policies, developing proper standard operating procedures for what kind of appropriate cleaning techniques should be used for the routine, your wards, your ICUs, your hotspot areas, your COVID areas. Developing policies for collection, transport. I just spoke about the biomedical waste, how it is segregated, how it is collected, how well it is transported from one place to the final place. And lastly, the disposal of the different types of waste as per the CPCB, Central Pollution Control Board guidelines are already demarcated 2019. So that should be followed and taken into account of. Pest control, how frequently it should be done, taking care of the mosquitoes, flies, and establishing method for cleaning and disinfection of bedding. How frequently the mattresses, pillows, and the linen should be, we'll be dealing in the next few slides. Now talking about cleaning of the room first. Patient is admitted with you. आपके पास एक patient आया है. We don't want the patient to carry on healthcare associated infection. If I can define healthcare associated, if a patient has come with X disease during the hospital setup in 48 hours of their incubation in the hospital, he or she is not developing with a Y disease. एक बीमारी के साथ अगर patient आया है, उसको कोई hospital setting में 48 hours के बाद कोई और दूसरी बीमारी नहीं add on हुई है, so that is good housekeeping practices, good practices in a hospital. That means patient is not having any healthcare associated infection. So therefore, it is important to clean the environment thoroughly on regular basis to reduce bacterial, viral, fungal load, because all the microorganisms combine and cause healthcare associated infections. I think you all might be aware of types of healthcare associated infections while working in your areas. Okay. Moving on, how frequently the floor should be cleaned? At least 4 times in 24 hours. In all the hospital settings, I wonder how frequently it is being done. Floor cleaning in the critical areas, definitely with a quaternary ammonium compound, and non-critical areas, if not 4 times in a day, but 2 to 3 times it should be done on daily basis. Walls to be washed with brush using detergent and water once in a week. And walls and blinds can be used up, can be washed up by low level of any kind of ammonium compound. High dusting to be done with a wet mop. Please ensure that mops should be clean. It should not be dirty when you are mopping any of the surfaces. Fans and lights are cleaned with soap and water once in a month. Obviously, we cannot use it very frequently. Once in a month, during the time of fumigation, during the time of deep cleaning of a particular area, you can clean up with soap and water, fans and light. All working surfaces are to be disinfected by wiping with 7% Lysol and then clean with detergent and water twice a day. If it is done, I think your hospital is much more a better place to work for. Very frequently, we come across in infection control that what should be the direction of cleaning the mops, wiping the mops, in which direction. So direction of cleaning in healthcare facilities must be from clean area to dirty area. That is a thumb rule. And in closed spaces like what, direction should be within outwards only. And उससे ज़्यादा important ये है देखना कि मतलब अगर दोनों तरफ से अगर लगाया जा रहा है mop, so this is not correct. Only unidirectional is the right method of mopping a particular surface area. As I said, direction of cleaning in healthcare facilities must be from clean area to the dirty area. Moving on next, how frequently these cupboards, shelves, beds, lockers, IV stands, stools, and other fixatives, it should be cleaned with detergent and water on weekly basis. And if any spillage is there, if any shelves are contaminated, if any beds are contaminated, make sure it is as and when it is required, it should be done. So clean with plastic weight and with spray bottles only. आप अगर इसको किसी कपबोर्ड को क्लीन कर रहे हैं, you don't have to dilute the whole thing and just spread it off. आप यूज कर सकते हैं किसी प्लास्टिक प्लेट में डाल के, या जो स्प्रे बॉटल्स आती हैं उसके अंदर आप स्प्रे करने के बाद then you can just wipe it off. It will be very helpful once in a week to clean such areas like cupboards, shelves, and beds. Right? Beds के bed railing की बात कर रहे हैं हम लोग. Then talking about there are tables and pots, they should be clean again. Deep cleaning of the area should be done and it should be placed once back to the position where it was lying. Then the next one is curtains. Curtains are changed once in a month or whenever soiled. बहुत ही ज़्यादा अगर कोई road traffic accident का patient आ गया emergency में, how frequently you should do it. So if it is quite badly soiled, you should done as per the requirement. Otherwise, once in a month cleaning of the curtains is required. Storerooms are to be mopped once in a day and high dusted once in a week. So deep cleaning has been the thumb rule, and cleaning from clean area to a dirty area should be mandatory in every healthcare setting. The floor of bathrooms are to be cleaned with a broom and detergent once a day. I think that is again very regularly done in all the setups. Toilets are cleaned with brush using detergent twice a day. Hydrochloric acid can be used once in a month for removing the stains, as it is very helpful. Wash basins are to be cleaned every day. Yes, there are places in laboratories where it is very frequently becomes dirty. I think twice daily or thrice daily can also be done for the wash basins. Regular maintenance of AC is required. This is very, very crucial when it comes to, we have the air conditioning systems. So how much positive pressure air, how much in the negative pressure areas, how much air exchanges can be done. जब हम कोविड के बारे में बात कर रहे थे, we are talking about isolation rooms. It requires 12 exchanges per hour. Positive pressure room requires more than that. AC maintenance, how frequently the HEPA filters are changed if the setup is like that, and how frequently the maintenance, once in a year or biannually, it is done, whether it's done by a particular company or how it is done. Rubber goods are to be cleaned with soap and water, disinfected, dried, powdered, rolled, and stored back. So talking about patient linen, we spoke about the cleaning area, that is mopping of the area. Now we talk about the patient linen. This is also one of the critical care elements which exist, and it is a very challenging part when we talk about healthcare setting. हमारे settings में linen को कैसे कहाँ use करना है, कब तक use करना है, अगर soil होगी उसमें क्या डालना है, ये चीजें बहुत important है. So bed linen is to be changed once in a day, and whenever soiled with body or blood body fluids. It will come further also. You're taking up a linen, you have used it. One side of the linen, आपने अगर bedsheet बिछाई है, so one side is used once, one day. The second side is used for the second day. Third day, linen should be changed. Patient gown is to be changed every day, and whenever soiled with body and body fluids, you have to discard it. You have to send it to the laundry as soon as possible. Dry dirty linen is to be sent to the laundry for regular wash. And linen soiled with blood and body fluids and linen used by patient is to be decontaminated in the ward by soaking in 7% Lysol for at least 1 hour. For many places, hypochlorite solution में डाल के 30 minutes के लिए 30 to 1 hour के लिए रखना है. Then it is sent to the laundry. So how collection of the contaminated linen is done? Contaminated linen should be handled with minimum agitation to prevent the generation of potentially contaminated lint aerosols in patient care. Then linen needs to be collected immediately in bags and should not be placed on the floor or any other surface for a longer time. आप ज्यादा देर के लिए मत रखिए, जैसे ही आपने बैग में पैक करके रख दिया है, you should send it across to the laundry area ASAP. The person who is handling should be wearing all the PPE, that is cap, mask, gloves, and eye goggles. The collected linen should be stored at a designated place, that is a dirty utility rooms, DURs. कई जगह पे कई hospitals में demarcation होती है. So आप उसी में ही dirty utility rooms में ही dirty linen को आप भेजिएगा, right? So packing of the contaminated linen is very important. Single bag में इसको करना होता है. Bag should be tied up properly. It should be labeled well. ये linen कौन से area से आ रही है? Which is a dirty linen, which is a dry linen. Proper labeling of the linen helps in identification. इससे traceability भी हो जाती है, and inventory management भी बहुत अच्छी हो जाती है कि आपने 7 भेजी है. How many linen you have sent? You have sent 10, and how much you will be getting back once it is sent to the laundry and cleaned back. So transportation कैसे होगा? ये तो आपको बताया है कि collect कैसे करना है, इसकी packing कैसे करनी है. Then we talk about कि इसको transport कैसे करते हैं. Generally, there are things called as I think we'll come here later. Okay, it was about linen out here. So generally how it is transported, there's a word called as laundry chutes. कई जगह पे there are it's a tunnel, a vertical shaft or a tunnel like position in a building through which dirty clothes can be dropped to the laundry area on the lower floor, and proper design से बनता है. That shaft area is quite efficient enough to send all the linen to the particular laundry area. So the laundry chute should be maintained under negative pressure to prevent any spread of microorganisms. And please ensure if the linen is loose, it is not tightly packed and or properly packed. Wet linen agar hai or heavily soiled linen agar hai, it should not be sent by the laundry chutes. So laundry chutes are actually meant, that vertical shafts are actually meant for the places jahan pe aap simple dry linens ko you can just displace it to the laundry area, right? And just look for in laundry chutes, there is no spillage or there is no transportation of dirty laundry into that. Talking about isolation rooms, linen should be stripped from the bed, and it should not be shaken, and it should be immediately discarded and sent labeled and transported well to the laundry area. All other articles like IV stands and furniture should be cleaned and disinfected well with any ammonium compound. Walls should be clean and disinfected. I think I have just said that walls and lines, low level of disinfectants will be very helpful. And bathroom should be cleaned with Lysol and the disinfection whichever you are using in your particular institutions. Now, talking about terminal disinfection, this word is very important. Why? Because this is at the time of discharge. When one patient is discharged, before taking up the other patient, please ensure keep an ultraviolet light in the room for at least in facing each direction for half an hour in a 2-bedded room, and for 1 hour in 4-bedded room. The use of UV light is very, very productive when we talk about disinfecting after the patient has left. So 2-bedded room, it is half an hour. For 4-bedded room, it is 1 hour. Pillows and mattresses are to be cleaned with detergent and soap, whichever the laundry people are using. Bed sheets, curtains, gowns, dusters must be removed and soaked with 7% Lysol for 1 hour. If it is deeply soiled, please ensure you can keep it for 2 hours also. Bedpan, urinal, kidney basin and disinfected, washed and dried, again using any soap and water care. Bath basins, multi-bin buckets, jugs, mugs are all with soap solution and dried. They are washed away with soap solution and dried. Rubber sheets are to be cleaned and dried with powders, and utensils of patients are washed, boiled, and ideally utensils of patients are washed and boiled by the F&B department, but please ensure proper surveillance activities are happening in your food and beverages area also. So the most important point, hand hygiene, hand hygiene, hand hygiene. I think the world knows via COVID, via many of the healthcare setups, they have been emphasizing. Recently, we have celebrated Hand Hygiene Week also. In that, we emphasize, since I come from a medical college, I definitely emphasize on hand washing in my medical students also. In our second year MBBS students, in postgraduates, that hand washing is one basic step. If you're following, I think 90% of the germs are microorganisms are killed. What are the 6 steps of hand washing? I think everybody knows. How frequently you should do the hand washing, when should be performed, before touching any patient, after touching any patient, after the hands are contaminated with any blood and body substances, after you have removed the gloves, or the basic essential, even which is what is followed at our homes also, after using the washrooms or toilet facilities, hand washing should be basically done. So the contact period of hand washing is 30 to 40 seconds. Merely taking 1 minute to do a proper hand wash, and for using a hand rub, the contact period is 15 to 20 seconds, and for using a hand rub, it is 30 seconds. So the contact period 30 to 40 seconds ही रहेगा. पूरा procedure करने के लिए आपको 1 minute लगता है. Same way, contact period for hand rub is 15 to 20 seconds. So how well you are using, when you are using, efficiently you are using it or not. If you are doing a proper hand wash, do it with the proper, as there are so many marketing of hand washes and hand rubs keeps on going. Whichever practice you want to follow, whichever brand you want to follow, I think everybody is open up to that. So wash all surfaces, including the back of hands, wrist, fingernails, and between fingers. Rinse well, dry hands, but please, after drying, don't just stripe again to your clothes only, or using a towel, or using with anything else. Please prefer a paper towel or tissue paper or napkins, and just discard it in the bins. Turn off water tap. Obviously, water is very precious, and using a paper towel instead of bare hands. So when you're closing your tap, please don't use the same hand, because you just washed. Say, don't follow the practices that with the same hand or what you have opened the tap, you're closing it over, because again, the microorganism lined up on the tap can be contaminating your hands again. So everybody is doing it. I hope everybody is doing it with a proper technique. What are the 6 steps of hand hygiene? I think in the last part of the class we'll discuss. Okay, linen and laundry, as I said, हमने काफी बात किया है linen and laundry के लिए. The source of microbial, efficient source of microbial contamination, I should say, and infrequently cause infection in hospital patient and personnel. अगर आपने इस area को ध्यान से नहीं रखा है, if the collection, if the transportation, if the packing, if the cleaning of the area is not done properly in the laundry area, I think then you're contaminating the patient surrounding, and hence you're contaminating patient and leading up to healthcare associated infection. That is how a good healthcare, good housekeeping practices comes in process. So guidelines applied to the management of linen and laundry are hand washing at most. When you're dealing with any soiled linen, please ensure hand washing, hand washing, hand washing. Protective barrier apparel should be used as follows. So gloves, when we talk about barrier methods, PPE should be used. Gloves, gowns, masks, cap, hand washing, it is ideal. All soiled linen is considered potentially infectious element to cause any infection to a given patient. Handle soil as little as possible. It is generally not possible, but if you have to, please ensure proper packing and labeling is done, and then only it is shipped to laundry, not with a laundry chute. So minimum agitation to prevent gross microbial contamination of the air and a person handling the linen. कम से कम लोग होने चाहिए, बहुत ज़्यादा crowded उस area को नहीं करना चाहिए, because more hands, more causative to the microorganism. All soiled linen should be packed at the location where it is used. It should be given back. And place all linen in the designated leak-proof laundry bags. I have already said that he designated or labeled होना चाहिए. Loose linen should never be thrown directly into the laundry chute. We have spoken, the linen chute should be cleaned by environmental associate. And when gross soiling occurs, please decontaminate the area with the proper soap and water. It should not be sorted or rinsed in patient care areas. आपको dirty utility room का इसीलिए है. You have to sort the things out in a dirty utility room, which is the dry linen, which is the soiled linen. Soiled linen should be directly sorted out and sent to the laundry, whereas the simple linen, your day-to-day used linen can be transported to the laundry chutes. So wear gloves, gowns, masks, safety glasses during this cleaning processes. Basic PPE, personal protective equipment, कोविड के टाइम से आई थिंक बहुत ज्यादा इसके बारे में एम्फसाइज कर चुके हैं. इट शुड बी फॉलोड अप. So laundry services, they are a centralized function coming under the housekeeping area department, taking care of all the activities from purchase of linen to laundry, how, when, and it should be disposed of. It will vary on the climate, culture, system, and procedure of the individual organization. So every college, every hospital has got their own setup, own set of people who work under this housekeeping laundry management area. So what is the thumb rule for linen management? Stock the linen materials in 1:3 ratio. Each day the bed sheet, I just said that it is dusted, the side is chained, and the bed is made. So this way both the sides of the bed sheet are used, and on the third day the bed sheet should be changed. The linen should be changed. Use all faded and damaged fabrics for dusting and cleaning windows. Practically, not everybody does that, because if there is a chunk, if there is any continuity में problem hai, if there is any the linen is torn or damaged, if it can be repaired via tailor thing. So minimal things can be repaired up. If it is in a very bad condition, it can be used as a dusting mop or for cleaning the windows and furniture, etc. of the healthcare setup. Functions of laundry department. So collection or receiving the soil and infected linen. Processing, the laundry cycle rushes from flushing, pre-wash, main wash, bleaching, rinse, souring, drying, ironing, packing, and storing, and sending it back to the particular area from where the labeled laundry packet has come. So processing the soiled linen through laundry equipment. This includes, again, sort, I repeat it. इसको आपने disinfect किया, sort किया, sluicing किया, disinfect here, washing, extracting, drying, conditioning, ironing, pressing, folding, and sending it back to the particular area where it is ideally it has come from. So distribution finished linen to the respective user departments. Maintenance and control of active and backup inventions and processed linen. So this is also very important. From the area from where you have sent, how many packets are there, how many linen sheets are there, that should be demarcated. When it is received by the laundry area, how many you received. Ideally, you should receive back and give it back the same numbers. This was from a particular area. And if there is any damage, you can just convey it to them. You can just write it on your checklist that yes, this particular linen is not in a good condition. It cannot be even repaired. Or it is quite damaged, so it can be used up for the mopping purpose, for the cleaning and sorting out purpose. Ensuring safety of the laundry staff through prevention and exposure to sharps. कई hospitals में when we had this COVID pandemic going on, rushing of the patient from one area to another, and when the patient was getting discharged, the second bed was taken up very fastly. So please ensure उस time पे UV light use करके for half an hour for 2-bedded and for 1 hour for 4-bedded. After that, many linen were just IV set अगर साथ पे लगाया उसी linen में drape out करके that is sent to the laundry area. So the healthcare staff of your laundry area is also very important to you. So उनकी health भी आपके लिए बहुत ज़्यादा important है. So कोई needle stick injury उनको ना हो जाए. Please ensure the linen what you are sending is not containing any of the needle or any sharp material. If anything happens, so they have to be taken care for the needle stick injury, and hospital has to pay the expenses. Wearing personal protective equipment. I think we have been talking about what are the most important protective devices: gloves, cap, face mask, gowns, aprons that can be full sleeves, gum boots which are very thick sole, eyeglasses and protective goggles, and protective eye sheet. So first and foremost, talking about gloves. When do you use gloves? It is basically for disease prevention only. Any disease is not transmitted from one person to another. So proper use of gloves is while using any invasive procedure, while doing any dressing, while handling any body or blood and body fluids, or dealing with any kinds of sharps and chemicals. Please ensure you're wearing gloves. Up next, beyond this handling of the patient, beyond this handling of the invasive procedures and the body fluids, wash your hands with soap and water before and after putting up the gloves and removing the gloves. And after wearing, one should not touch any other thing beyond the workstation or workplace wherever the person is about to work. Ideally, gloves should be used and it should be removed after examining or after every patient. But if not possible, somewhere in the dental practices, which is shown in this picture. So please dip the hand along with the gloves only. With your gloves on, you can just use 1% hypochlorite solution for 1 minute and you can use it for the next patient. But in an ideal situation, please change the gloves and go to the next patient. Ensure a proper disposal. Ideally, it should be cut. Again, use 1% hypochlorite solution. It should be cut properly, and then gloves are segregated in red colored paint. So thick layer gloves to be used by the waste handlers by handling biomedical waste. Up next is cap and face mask. I think the world, due to COVID, N95 masks, respirators, many of the inhalation or airborne diseases which can be prevented by using a face mask. It is quite ideal. So wear at least cap and mask while working in the wards, and wear the mask in such a way that it covers your both mouth and nose. I think by now everybody knows how to put on a mask. If it is soiled with blood and body fluid, please immediately remove it. Wear them during all the surgical procedures as it is mandatory, and wear while working in a sterile field to prevent droplets or any contaminating the field. So any aerosol generation or any airborne infection, please wear your face mask. And next is gown and aprons. A full gown, a full plastic gown, if it is ready to use and use and throw ones, it is ideal. If not all the hospitals can afford to have that. So first and foremost, it should be large enough to cover the whole body from neck to knee, made of moisture resistant material that provides an effective barrier, and sterile gowns should be worn for procedures that require a sterile feel and can be thrown off. How frequently it should be changed? If you're using the cloth gowns, please ensure it is very well. If it is soiled with blood or body fluids, please send it to the laundry as soon as possible. If not, every weekly the gown should be replaced. For cleaning, put them in 1% hypochlorite solution for 30 minutes and wash with good amount of soap and water. After drying, they should be auto-cleaned. So next is gum boots. Many a times in biomedical waste areas, इस चीज को बहुत नजरअंदाज किया जाता है. It should be used while working in the operation theaters and labor rooms. Apart from that, the person who is dealing with biomedical waste, gum boots are very important with a thick sole. So it doesn't prevent any injury, any transmission. कभी OTs में कभी कोई instrument गिर गया, कभी scissor गिर गया, कभी कोई metal implant गिर गया. So it should not harm anybody's feet or any nail or any other area of the foot. So please ensure gum boots to the people, especially working in the OTs and the labor rooms. And then because of the biomedical waste fellow who is taking care of the biomedical waste discarding, please ensure कोई needle stick injury ना हो जाए उसको, कोई पैर पे कोई again कोई needle कोई sharp ना गिर जाए, उसके लिए gum boots उसको देना बहुत ज्यादा जरूरी. Eyeglasses. Is there any body splash? Is there any blood or body fluids which can be contaminating your eyes? Sometimes in OTs there is ooze of blood. So when there is a pool of blood which is coming out, and that the splash of blood which is coming out suddenly from patient, if you have those cases, eyeglasses and protective goggles are very, very important. And especially if visibly soiled, it can be cleaned with 70% alcohol solution. Shield and face shield, this thing has got very much utmost importance in radiology department. So while working in radiation prone environment, it protects you from radiation hazards. Also wear a dosimeter to estimate the quantum of exposure to radiation. इसी के साथ आता है. And face shield are more to prevent blood and body splashes from the contaminating the mucous membrane of eyes, nose. अगर आपने face shield लगाया है, so you will be quite safe from if a splash of body fluid or any blood has just come out. Eyes, nose और mouth के आपके उसमें splash नहीं आएगा. So last but not the least, when we talk about improvement, yes, the housekeeping department is a non-revenue department. They don't provide you any hospital setting, they don't provide you revenue, but in fact they take up the finances because the infection control practices को improve करने के लिए काफी सारा sterilizing, cleaning, disinfectants आपको चाहिए होते हैं. So it is quite a major chunk which is required to get the best of best practices to be followed in your housekeeping activity. So a poorly run department results in money needlessly spent and creates a negative impression on patients, visitors and staff, it is directly proportional to the image of the hospital. Because if your housekeeping is not good, if they are not provided with finances, if their results are poor, your hospital setting will not be clean, your environment won't be clean, it won't be in hygiene. और अगर hygiene नहीं होगा, so the patient, the public, visitors, your healthcare staff will not be in a good environment to work, and the reputation of the hospital can be on stake. Because if the practices are good, the hospital has good practices, and then they get the further accreditations also. So this was all about my whole presentation.